Hello, I'm Beth Wagner, physical therapist. In this video, I'm going to show you an excellent tibial nerve flossing exercise. This series of flossing or gliding movements helps to relieve tibial nerve entrapment and tarsal tunnel syndrome. The tibial nerve is a branch of the sciatic nerve that runs down the back of the leg, around the inside of the ankle, and into the sole of the foot. The tarsal tunnel, located on the inside of the ankle, is a common place of entrapment. The most common symptoms of tibial nerve entrapment and tarsal tunnel syndrome include weakness of the ankle and foot, and pain, numbness, and tingling in the sole of the foot. In addition to relieving nerve compression at the site of the entrapment, it's often very beneficial to perform strengthening exercises, postural correction, and use of an arch support, especially if loss of the natural arch of the foot is the cause of tibial nerve entrapment and tarsal tunnel syndrome. Now let's move on to the nerve glide. Nerves do not like to be stretched. Instead, they respond well to gliding or flossing, which is to move one end at a time to mobilize the nerve through the area where it's pinched or compressed. The movements are performed gently in slow and smooth repetition. There's no hold involved. Mild discomfort is common, but numbness and tingling are signs that the nerve is being compressed or overstretched, which is not our goal. If you feel numbness and tingling, or if your baseline numbness and tingling worsens as you're going through this exercise, stop the movement, shake it out, and rest. Try again after the numbness and tingling stop, or return to baseline. You don't need any equipment for this exercise, but it can be helpful to use a belt, strap, or band to support your leg and to guide the movement. The tibial nerve glide is best performed lying down. Find a comfortable place to lie on your back with pillow support under your head. Keep your strap or band handy. We'll start the nerve glide at the ankle. Wrap your strap or your band around the bottom of your foot. With your leg straight, turn your ankle and toes out to the side. Pause, and then bring your foot back to the middle. Again, turn your toes and ankle out to the side, pause, and return to the center. Continue with slow, smooth movement. Ankle and toes turning out, and then coming back to the center. Perform 10 repetitions at a slow, smooth, consistent pace. Now the second position of the nerve glide will add movement at the knee. Maintaining the strap under the arch of the foot, bring one side of the strap to the inside of the knee. Keep the other side of the strap on the outside of the knee. Bend your knee with your heel resting on the surface. Now turn your ankle and your toes out to the side, and with slow, smooth motion, straighten your knee. Pause at the top, and then bend the knee. Return your heel to the surface. Straighten again, not all the way till your knee hyperextends. Maintain a little bit of flex, a little bend in the knee at the top. And return to the starting position. Continue with slow, smooth motion for 10 repetitions, or as many as you feel comfortable to start with. Now we'll bring the floss up to the hip. Start with your legs straight, the strap under the arch of the foot. Turn your ankle and toes out to the side. And now using the strap to support the weight of your leg, lift your leg straight up, just as far as you feel comfortable going. Pause, and then lower. Again, keep your knee straight, but not hyperextended. There should be a little bit of flex, a little flexibility in the knee. Again, lift the leg straight up, maintaining the position of the toes and ankle turned out. Pause at the top, and then lower. Lift the leg with a straight knee, but not hyperextended. Toes and ankle turned out. Pause at the top, and lower. It can also be helpful to match your breathing with the movement. Deep breathing helps to calm the nervous system. I suggest exhaling as you initiate the movement. Inhale, lower. Continue at a slow, smooth pace for 10 repetitions, or as many as you can start with. After 10 repetitions in each position, then rest. You can set your strap aside, shake out your leg, let your toes and ankle relax. If you have symptoms only on one side, it's just fine to do the nerve glide on that side only. For symmetry and overall flexibility of muscles and connective tissue, it can be beneficial to go ahead and do the nerve glide on the other side. For best results, perform 1 to 2 sessions a day. Shoot for daily performance, but if you can do these 5 to 6 days a week, that's just great. I hope you found this tibial nerve glide or flossing exercise helpful to relieve tibial nerve entrapment and tarsal tunnel syndrome. If you like this video, please click the thumbs up and subscribe to my channel. Now, there are other spots along the pathway of the nerve where it can become compressed. Please check out my video on sciatic nerve glides, which might provide additional benefit for you. Other contributing factors might arise from issues in the lower leg and foot, such as tightness of muscles, tendons, ligaments, and fascia. I've posted many videos focused on foot, ankle, and leg conditions that might be helpful for you, such as plantar fasciitis and many other topics. I've included links to these videos in the description below. Please leave any comments and questions down below, and I'll get back to you as soon as I'm able. Here's to your healing, health, and happiness. Have a fantastic day.